Disclaimer. This video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always consult your physician or a qualified healthcare provider for personalized guidance.
All right, let's get right into it. Today, we're going to take a hard look at something we've been told about heart health for, well, pretty much the last 50 years. We're going to talk about why your cholesterol numbers might be giving you a completely misleading picture of your actual risk for a heart attack.
For decades, every health campaign, every doctor's visit, it's all pointed the finger at one single bad guy, one culprit that was supposedly responsible for all our heart problems.
Yep, cholesterol. More specifically, that bad LDL cholesterol. It's been painted as public enemy number one in the whole war on heart disease.
But what if that's not the whole story? What if focusing so hard on this one number has made us miss what's really going on inside our bodies? What if the real danger isn't just the cholesterol itself? Okay, so this is where we really have to shift our thinking. The new way to look at heart health is all about getting past that simple number on a lab report and looking at what's physically happening inside your arteries.
And this quote it nails it. Look, cholesterol is not inherently evil. Our bodies need it to build cells and make hormones. The real problem starts when that cholesterol actually causes physical damage and starts building up as plaque inside our arteries.
And the old story just has so many holes in it. Doctors see this all the time. You get patients with crazy high LDL cholesterol, but their arteries are squeaky clean. And then you see others with perfect cholesterol numbers who are walking around with a ticking time bomb of a blockage they know nothing about. Relying only on blood tests just creates so much unnecessary anxiety and medication for some, while it gives a totally false sense of security to others.
So to really help this click, I want to use a really simple analogy. Let's think about your car for a second.
Think of your cholesterol test as the fuel gauge in your car. All it does is tell you how much fuel, LDL, HDL, is floating around in your bloodstream, in the tank. But your artery health? Well, that's the engine itself. That tells you about the actual condition, if there's any real wear and tear, any actual damage.
And this is the absolute key takeaway. You can have a full tank of the best premium fuel, but that tells you literally nothing about the state of your engine. It doesn't tell you if your pistons are worn or your oil is low. A full tank doesn't mean your engine isn't about to break down. It's the exact same with your heart. Okay, so if the blood test is just the fuel gauge, how do we actually check the engine? How do we look under the hood? Well, luckily, modern medicine has an incredible tool that lets us do just that. It's called a coronary CT angiogram, and it's this amazing, non-invasive scan that gives us a super detailed 3D map of your heart's arteries. It means that, for the first time, we can literally see if there's any plaque, any narrowing, any problems at all. No more guesswork.
And just look at this comparison. A traditional stress test, which is what we used to rely on, often won't find a problem until an artery is already over 70% blocked. At that point, you're in serious trouble. But the CT scan, it can spot the tiniest, earliest signs of plaque, giving us a huge head start to do something about it.
Let me give you a real-world example. We've got a 38-year-old guy. He feels perfectly healthy, exercises, and his cholesterol numbers are great. His fuel gauge says full. But he gets a CT scan, and it finds a 60% blockage in one of his main arteries. His blood test gave him zero warning.
Now, let's look at the flip side. A 55-year-old woman, she's got high LDL, and she's been worried sick for years about having a heart attack. Her fuel gauge is constantly flashing red. She finally gets a CT scan, and guess what? Her arteries are perfectly clean, not a speck of plaque. Her engine is pristine. She doesn't need to be on aggressive medication.
So, what do these stories tell us? They show us that there's a much smarter way to approach treatment. It's about treating the actual engine, not just reacting to the number on the fuel gauge.
So the new game plan is actually super simple and logical. Step 1, look under the hood with the scan. If you see plaque, then yes, medications like statins can be absolute lifesavers. But if those arteries are clean, then the number one priority should be lifestyle and prevention.
And that really is the bottom line here. Before we ever jump to prescribing pills, the foundation of good heart health has to be lifestyle. The way you eat, the way you move, those are the most powerful tools we have, especially when we know the engine is still running smooth.
All right, let's wrap this all up into a clear action plan. What does this new way of thinking actually mean for you, starting today?
Now,
Of course, your genes do play a role. About a quarter of us are kind of genetically predisposed to heart issues, and another quarter seem to have some genetic protection. But for that huge 50% in the middle, and that's most of us, our destiny is not in our DNA. It's in our daily choices.
And you want to know one of the most powerful choices you can make? It's this simple. Just walking 8,000 to 10,000 steps a day. The science is clear. It dramatically slashes your risk of a heart attack. It costs nothing and it works.
So let's recap the new rules of the game. First, prioritize getting a look at your arteries, not just your blood work. Second, base any treatment on actual physical damage, not just a number. Third, make walking 8 to 10,000 steps a day a non-negotiable, break up all that sitting we do. And finally, start thinking about this stuff early, even in your late teens.
So I'll leave you with this one simple question. When it comes to the single most important machine you will ever own, your body, are you just going to keep checking the fuel gauge, or are you finally ready to look at the engine? All right,